Okay, Bismillahirrahmanirrahim. Now we are starting our lower limb part 4 video. 31 question. A 61-year-old female immigrant had been diagnosed with spinal tuberculosis. The woman had developed a fluctuant red tender bulge on one flank with a similar bulge in one groin on the same side. The presentation is likely due to the spread of the disease process within the fascia of a muscle with which of the following actions at the hip. Options are abduction, adduction, extension, flexion, internal rotation, and the answer is flexion. Psoas abscess tracks along the psoas major fascia to the groin. Psoas muscle basically flexes the hip. Now comes to the question number 32. In an accident during cleaning of an old residential area of the city, the Achilles tendon of a 32-year-old worker was cut by the blade of a brush cutter. The painter is admitted to the hospital and a laceration of the Achilles tendon is diagnosed. Which of the following bones serve as an insertion for the Achilles tendon? This is a very common question and easily and mostly usually asked in the viva as well. And the options are calcaneus or calcaneum bone, fibula, cuboid, talus, and navicular. The Achilles bone is inserted onto the posterior calcaneus or calcaneum bone. Calcaneum is the answer, that is A. Now comes to the question number 33. A 27-year-old female tennis pro injured her ankle during the quarter-final match. A physical examination at the outpatient clinic revealed a severe inversion sprain of the ankle. Which of the following structure is most likely damaged in such injuries? The options are medial plantar nerve, tibial nerve, anterior talofibular ligament, posterior talofibular ligament, deltoid ligament. The option is anterior talofibular ligament. Most common injury in inversion sprain of the ankle is anterior tibiofibular ligament. Question number 34 is a 41-year-old man is admitted to the emergency department with a swollen and painful foot. Radiologic examination reveals that the head of the talus has become displaced inferiorly, thereby causing the medial longitudinal arch of the foot to the fall. What would be the most likely cause in this case? Tearing of the plantar calcaneo navicular or spring ligament, fracture of the cuboid bone, interruption of the plantar aponeurosis, sprain of the anterior talofibular ligament, sprain of the deltoid ligament. The option A, the answer is A, that is supports the head of the talus and medial longitudinal arch. Its failure lets the talar head. Now comes to the question number 35. During a football game, a 21-year-old wide receiver was illegally blocked by a linebacker who threw himself against the posterolateral aspect of the runner's left bone. As he lay on the ground, the wide receiver grasped his knee in the obvious pain. Which of the following structures frequently subject to injury from this type of force against the knee? Options are fibular collateral ligament, anterior cruciate ligament, lateral meniscus, and posterior cruciate ligament, fibular collateral and posterior cruciate ligament, and all the ligaments of the knee will be affected. Reasoning is the option is anterior cruciate ligament. A. Lateral and rotational blow commonly produces valgus plus twist. Anterior cruciate ligament injury is frequent, often with medial collateral ligament, medial meniscus, but anterior cruciate ligament is the key at the risk structure. Question number 3 is lower limb angiography of an 82-year-old woman reveals a possible cause for her limb pain during her workout routines in the health spa. The artery that was occluded in one that should have one been demonstrated passing between the proximal part of the space between the tibia and the fibula. Which of the following artery is most likely to get affected? Deep femoral, popliteal, posterior tibial, fibular, which is also known as peroneal or anterior tibial. The answer is E, that is anterior tibial, as it passes through the proximal opening to the introitious membrane from the popliteal anterior compartment. Now comes to the question number 37. A 43-year-old woman visits the outpatient clinic with a painful swollen knee joint. The patient's history revealed chronic gonococcal arthritis A knee aspiration is ordered for bacterial culture of the synovial fluid. A standard suprapatellar approach is used, and the needle passes from the lateral aspect of the thigh into the region immediately proximal to and to the deep to the patella, through which of the following muscle would be the needle pass: adductor magnus, short head of biceps femoris, rectus femoris, sartorius, vastus lateralis. The answer is E, that is vastus lateralis. Supratellar lateral approach enters the supratellar bursa deep to the quadriceps, needle transverse vastus lateralis. Now comes to the question number 38, that is a 38-year-old male power lifter visits the outpatient clinic because he had a difficulty walking. During physical examination, it is observed that the patient has a problem unlocking the knee joint to permit flexion of the leg. Which of the following muscle is most likely to get damage? Option A is bicep femoris, B gastrocnemius, popliteus, semimembranosus, rectus femoris. Reasoning is C is the popliteus. Unlocks the knee usually by laterally rotating the femur or medially rotating the tibia to initiate the flexion. This question can be asked to you in the two scenarios, by making two scenarios. Question number 3 is a 32-year-old male basketball player comes down hard on his ankle. He is admitted to the outpatient department, and radiologic examination reveals a Pott's fracture. That is a very commonly asked question. Which ligament is most likely injured? Calcaneofibular ligament, deltoid ligament, spring ligament, plantar ligament, long plantar ligament. Reason is Pott's fracture, that is eversion injury. Deltoid ligament avulses medial malleolus and contributes to the fibular fracture. Question number 40 is a 23-year-old man is admitted to the emergency department with pain and cyanosis of his right lower limb. Deep Doppler ultrasound studies reveal deficiency in the development of his femoral artery, which appears to terminate mid-thigh. Thrombotic occlusion is seen in the unusual, rather tortuous, large vessel in the posterior compartment of the thigh, arising in the gluteal area and continues inferiorly with a normal appearing popliteal artery. It is decided that a vascular graft should be placed from the femoral artery to the popliteal artery. What is the identity of the aberrant artery? The answer is B, an sciatic branch of the inferior gluteal artery. The described vessel is a large artery rising in the gluteal region, running in the posterior thigh and continuing as the popliteal artery. Classically, this is a persistent sciatic internal iliac artery and embryologic continuation of the internal iliac that supplies the limb when the femoral artery is hypoplastic. The inferior gluteal region is the logical source in adults. The persistent sciatic artery runs with the sciatic nerve through the gluteal region and the posterior thigh. Why the other choices are unlikely? A is you can read it by your own. Thank you.